I've been talking lately about fibroids today, especially this week. This week, my videos has been on fibroid. So something occurred to me today. I was like, do we even know that there are different types of fibroid?
God have mercy upon us.
Yes, there are different types of fibroid, and the kind of fibroids you have will determine the type of symptoms you have. All right, so in this video I'm going to be talking about the types of fibroid, what fibroids actually are, and the test you should do to know the type of fibroid you have. So sit tight, get your pen as usual, because you're going to be learning one thing or the other. So let's move. So what actually are fibroids? Yes, as you can see, let's get a diagram and let's see a picture of a fibroid, and let's go. Fibroid, as you can see from this picture, are non-cancerous growths that can either occur inside the womb or surrounding of the womb, as you can see from this picture up here. Now, fibroids has muscles and also fibrous tissue. The same muscles and fibrous tissues are what is also found in the uterus. So they are more or less like growth that mimic the womb itself. So you see, fibroid. And fibroids occur when you have a very high level of progesterone and also high level of estrogen. That's why it's usually very common among the reproductive age. That's where these hormones are peak. So that's why you see fibroids occurring in women in their reproductive age. And surprisingly, they begin to shrink when you get your menopause, because in menopause, these hormones tend to decline. So that's how fibroids work. Fibroids are mimicking their non-cancerous. So the good news is that they rarely turn to cancer, yes, but in some cases, in very rare cases, they can also turn to cancer, but very rarely they turn to cancer. So let's dive down to what are the types of fibroids. So one of the very common type of fibroid we have is the intramural. If you can see from this video, see the intramural there. These are fibroids that grow inside of the muscle of the womb. Okay, so they are less common and they are less severe. They present with heavy bleeding and pain, okay, but they rarely disturb fertility. So somebody with intramural fibroid can actually conceive without much issue. The number 2 type of fibroid we have is the submucosal. This is the very most severe type of fibroid that we have. Yes, because this is the type of fibroid that grow inside of the womb, like in the womb cavity. This is where it grows. So you can imagine now, this fibroid growing inside the womb, it means that it will have the possibility of stopping your child from growing. And this is the most severe type of fibroid that we have. It is less common, but it's very severe because it comes with heavy bleeding, it comes with severe pain, it is more prone to complications, and it's very common with infertility. This is the type that when you have this kind of submucosal fibroid, you have difficulty in getting pregnant. Yes. Another type of fibroid we have is a pedunculated fibroid. Pedunculated fibroid is a fibroid that has a finger-like projection. Apart from the big size of fibroid I have, it has a finger-like projection, pedunculated. So this one is very less common, and it comes with less symptoms. Another type is cervical fibroid. This one is less common. This is where you have the growth inside of the cervix. I know what that means. Sometimes labor can be so difficult because the child will have no passageway to come out. So the best way for you to know the kind of fibroid you have is to do a pelvic ultrasound scan, or the abdominopelvic ultrasound scan, where they will detect the type of fibroid you have, because it's going to show the exact location where these fibroids are. So depending on the location of the fibroid and the size of the fibroid, we advise that you either take it out if the size is big, so that it will not obstruct fertility, it will not give you complication, because I'll be talking about complications of fibroid very soon. So make sure you stick to this page. All right, so these are the different types of fibroids we have, although we still have some rare ones, but these are the ones that are very common in our environment. So now you've learned one thing, that fibroids are non-cancerous growths in and around the womb, and they're very common in reproductive age, and it is very linked to estrogen and progesterone. And lastly, we have several types of fibroid. The very most severe one is the submucosal. So if you like this video, make sure you like this video, you follow, you comment, you share, and if you have any question, you can drop in the comment section. This is Dr. Comfort, and this is Health Talk with Dr. Comfort. Have a lovely day. Bye-bye. Love you.